NHA Phlebotomy practice questions. Question 1. During a timed glucose tolerance test, a phlebotomist draws a specimen 7 minutes late due to an emergency interruption. What is the most appropriate documentation action? Discard the specimen and restart the entire test. Record the actual collection time and notify the laboratory. Adjust the reported time to match the testing schedule. Label the specimen as fasting instead of timed. Timed tests depend on precise documentation, not perfection. When a delay occurs, the specimen is still usable if the actual collection time is accurately recorded and the lab is notified. Altering times or relabeling is falsification and invalidates results. Question 2. A patient with an active arteriovenous fistula for dialysis has no visible limb alert. The physician orders stat blood work. What is the safest action? Use the fistula arm carefully with a small needle. Draw distal to the fistula site. Confirm with nursing staff and use the opposite arm. Use a finger stick to avoid venipuncture. Blood must never be drawn from a fistula arm even distal to the site due to clotting and infection risk. If no alert is present, the phlebotomist must verify with nursing staff and select the opposite arm. Finger sticks are not acceptable substitutes for ordered venous tests unless specifically authorized. Question 3. Which situation presents the highest risk for specimen hemolysis even when needle size is correct? Shaking additive tubes vigorously. Transferring blood too slowly into tubes. Drawing from a hand vein using a syringe. Releasing the tourniquet after tube removal. Vigorous shaking causes mechanical rupture of red blood cells leading to hemolysis. Even correct needle gauge and gentle draws cannot prevent damage caused by improper tube mixing. Tubes should always be inverted gently, not shaken. Question 4. A blood culture set is drawn after antiseptic application, but the site is accidentally touched with a gloved finger. What is the correct response? Reclean the site with antiseptic. Clean the glove and continue. Proceed since gloves are sterile. Apply alcohol only and proceed. Touching the site after antiseptic application contaminates it even if gloves are worn. The site must be fully recleaned with the appropriate antiseptic to reduce false positive culture results. Skin flora are the primary source of blood culture contamination. Question 5. Which condition most significantly increases the risk of falsely elevated potassium levels? Prolonged tourniquet application. Drawing blood above and fore site. Allowing the patient to pump their fist. Using a butterfly needle. Repeated fist pumping causes potassium to shift from muscle cells into the bloodstream, leading to pseudohyperkalemia. This effect is more significant than prolonged tourniquet use and is a common cause of falsely elevated potassium levels that can lead to inappropriate emergency treatment. Question 6. A patient becomes pale and diaphoretic immediately after needle removal but before standing. What phase of syncope is occurring? Recovery phase. Vasovagal response onset. Postural hypotension. Hyperventilation reaction. Pallor and sweating before loss of consciousness indicate the onset of a vasovagal response. Recognizing early signs allows intervention before full syncope occurs. Immediate action includes removing the needle, if still in place, and positioning the patient supine with legs elevated to restore cerebral blood flow. Question 7. Which tube must never be drawn using a syringe transfer without a safety device? Light blue. Gray. Blood culture bottles. Serum separator tube. Blood culture bottles require strict aseptic technique and controlled pressure. Manual syringe transfer increases contamination risk and can compromise culture accuracy. A blood transfer device should always be used when transferring blood from a syringe into culture bottles to maintain sterility and prevent needle stick injuries. Question 8. A phlebotomist notices petechiae forming distal to the tourniquet site during collection. What does this most likely indicate? Excessive vacuum pressure, platelet dysfunction or capillary fragility, tourniquet allergy, needle bevel damage. Petechiae, small red spots, suggest fragile capillaries or platelet disorders. This finding should be documented and may require prolonged pressure after needle removal. The tourniquet should be released promptly, but the draw can continue as petechiae alone do not require discontinuation of the procedure. Question 9. Which action is required when collecting specimens from a patient on continuous FOR fluids? Stop the FOR for 2 minutes. Draw above the FOR site. Draw from the opposite arm when possible. Use a smaller gauge needle. Drawing from the opposite arm eliminates dilution and contamination risks from FOR fluids. Stopping IVs does not fully prevent fluid interference and is not preferred. If the opposite arm is unavailable, draw below the FOR site after pausing the infusion for at least 15 minutes, with provider approval. Question 10. A specimen labeled correctly but transported without temperature control arrives clotted. Who is responsible? Laboratory receiving staff, courier service, phlebotomist, ordering provider. The phlebotomist is responsible for proper specimen handling and transport conditions. Failure to ensure correct temperature can compromise specimen integrity, leading to clotting or analyte degradation. Proper transport conditions, room temp, refrigerated, or frozen, must be maintained according to test requirements. Question 11. Which factor most affects coagulation test accuracy? Tube expiration date, incorrect blood to additive ratio, needle gauge, tourniquet placement. Light blue tubes require precise fill volume to maintain the 9:1 blood to anticoagulant ratio. Underfilling creates excess citrate, falsely prolonging PT/INR values, while overfilling leads to inadequate anticoagulation and microclots. Either error can result in incorrect anticoagulant dosing and serious patient harm. Question 12. A patient refuses to state their date of birth but confirms their name. What is the correct action? Proceed if wristband matches. Ask nursing staff to confirm. Use medical record number only. Delay collection until 2 identifiers are verified. 2 unique patient identifiers are mandatory for patient safety. Without proper verification, full name and date of birth, specimen collection must be delayed. Accepting a single identifier increases the risk of misidentification, which can lead to catastrophic diagnostic errors and patient harm. Question 13. Which complication is most associated with repeated venipuncture at the same site? Hemolysis, thrombosis, infection, hematoma formation. Repeated trauma to the same vein increases the risk of clot formation within the vessel, thrombosis, which can damage the vein and compromise future vascular access. Rotating venipuncture sites is essential for patients requiring frequent blood draws to preserve vein health and prevent complications. Question 14. Why should blood alcohol specimens be drawn using non-alcohol antiseptics? Alcohol evaporates too quickly. Alcohol causes hemolysis. Alcohol contaminates test results. Alcohol causes clotting. Alcohol-based antiseptics can falsely elevate blood alcohol results, compromising legal and clinical validity. For blood alcohol testing, use non-alcohol antiseptics such as chlorhexidine, povidone iodine, or soap and water followed by sterile water rinse to prevent contamination and ensure accurate forensic results. Question 15. Which specimen is most affected by delayed centrifugation? CBC, serum glucose, blood cultures, ESR. Cells continue to metabolize glucose after collection, causing falsely low results if centrifugation is delayed. Serum should be separated within 2 hours of collection, or the specimen should be stored in a fluoride tube, gray top, which inhibits glycolysis. Delayed centrifugation also affects potassium and other analytes, but glucose is most sensitive. Question 16. A patient on anticoagulant therapy bleeds longer than expected after venipuncture. What is the best response? Apply pressure for an extended time. Use a pressure bandage immediately. Elevate the arm. Ice the site. Extended direct pressure, 5 to 10 minutes or longer, is the safest and most effective method to control bleeding in anticoagulated patients. Anticoagulants impair clot formation, so prolonged pressure is essential to prevent hematoma formation. Elevation and ice are adjunctive but not substitutes for adequate pressure. Question 17. Which order of draw error most risks additive carryover? Red before gold. Lavender before light blue. Green before lavender. Gray before green. EDTA, lavender top, contamination can severely affect coagulation results if drawn before light blue tubes. EDTA binds calcium, which would falsely prolong PT/INR results. Following the correct order of draw prevents additive carryover that can dramatically alter test results and lead to dangerous clinical errors. Question 18. What is the primary reason for avoiding venipuncture on the site of a mastectomy? Increased infection risk. Altered lymphatic drainage. Patient discomfort. Reduced venous pressure. Lymphatic disruption from mastectomy increases swelling and infection risk, making venipuncture unsafe on that side. Even small trauma can cause long-term lymphedema and complications. The unaffected arm should always be used when possible. If both arms are compromised, provider approval and special precautions are required. Question 19. A specimen leaks during transport but labeling remains intact. What should occur? Wipe and accept specimen. Transfer contents to a new tube. Reject specimen and recollect. Centrifuge immediately. Leaking specimens compromise safety and integrity and must be rejected. A leak indicates potential contamination or improper tube sealing, which can affect test results. Patient safety requires recollection rather than attempting to salvage a compromised specimen. The incident should be documented per facility policy. Question 20. Which situation requires incident reporting even if the patient appears unharmed? Multiple needle attempts. Minor bruising. Near syncope episode. Equipment malfunction. Equipment malfunction presents ongoing safety risks and must always be formally reported. Even if no patient harm occurred, malfunctioning equipment could injure future patients or staff. Incident reporting triggers equipment inspection, repair, or replacement, preventing potential injuries. Multiple attempts, minor bruising, and near syncope may also require documentation but are not always mandatory incident reports.